Welcome to Your Need to Know. I'm your host, Catherine Reed, and joining me tonight is Jill Hanken. She is a health attorney with the Virginia Poverty Law Center, and we're going to be talking about open enrollment, which began on November 1st and runs through December 15th for those who are using or accessing their health care through the Affordable Care Act. So welcome, Jill. We appreciate having you here to talk to us about Enroll Virginia and the services that have been set up specifically for Virginians who need assistance in figuring out what their best options are for health care.
Thank you, Catherine. Thanks for having me today.
So tell us a little bit about, when Enroll Virginia started and the kinds of services that are offered and who it's designed for. Who are you reaching out to?
Well, thank you. Enroll Virginia is a project of the Virginia Poverty Law Center. We've been in place for the last 8 years, providing information, outreach, and application assistance to Virginians who are seeking health insurance. The Navigator project was initiated through the Affordable Care Act, specifically to help people enroll in the new federal marketplace that was part of the Affordable Care Act, and where over 10 million people now get their health insurance across the country. And the navigators, again, are in place to help consumers directly with their healthcare needs, and we work one-on-one with people who need to apply for health insurance, and we also provide information. And in previous years, we've done a lot of outreach programming to reach consumers, and this year with COVID, it's a little more difficult for us to get the information out to everybody in larger groups, but we are available to help folks get the insurance they need. And I should say it's through the marketplace, but also through other public health insurance programs, like our Medicaid program. A famous program is a program for low-income children and pregnant women. We also help people transition into the Medicare program. So we do have a team of experts who are familiar with the various health insurance options and can help people understand where they fit in. I would also say, significantly, since Virginia adopted Medicaid expansion in January of 2019, most Virginians have a place to go for their insurance, either Medicaid or the marketplace or famous or Medicare. And at the same time, the majority of Virginians are still getting their health insurance through their employers. But as you can imagine, that has also been upset by
COVID, right?
By COVID. People who have lost their jobs often also lost their health insurance through their former employers, and they are now in the market to get health insurance from another source, and we want to be able to help people with that task.
And something people may not have considered too is if your hours were reduced, and that's something you pointed out to me. I'm very grateful all three of my adult children still have their employment, but one of my children who's on the ACA has had her hours reduced, and it never occurred to me that there are people, even if you're still employed, who may have fallen income-wise into a place where you could be eligible for Medicaid from the exchange if you're currently getting your health insurance with the ACA. And I had not even considered that.
Right, exactly. And it's very helpful that the marketplace through healthcare.gov, that's the website, healthcare.gov, will also look at someone's eligibility for state Medicaid. Because if you're eligible for Medicaid, you're not eligible for ACA marketplace coverage. And people should know that Medicaid is very comprehensive, very low cost, and because of Medicaid expansion, more and more people now get their health insurance through through Medicaid. In fact, there are over 470,000 Virginians who now get health insurance through the Medicaid expansion, and a lot of those people only enrolled since March as a result of loss of other coverage related to COVID. So thank goodness we have a great safety net now in Virginia for people losing employer-based coverage, or as you say, people whose salaries have just gone down may find themselves now eligible for Medicaid. And folks, it's a lot less expensive than anything you could get through the federal marketplace, even though the federal marketplace will provide tax credits to help people pay for the cost of their premiums. But all the marketplace plans have premiums and deductibles and some cost sharing. If you're at the lower end of the scale, income scale, you get very generous tax credits and even lower cost health insurance. But Medicaid, because it serves the lowest income category of folks, is even less expensive. So just I've given Catherine a lot of charts with a lot of numbers, but just so people know basically what we're talking about. If an individual has income under about $17,600 a year, that individual can now get coverage through the Medicaid program. And in the marketplace, that individual who has more than that 17,000 will still get tax credits even if their income goes up to $51,400 a year, but the amount of the tax credits changes as your income goes up. So there are lots of rules about income, rules about how to determine a household size. Most of the Affordable Care Act does use the federal income tax system for determining households and which income to count. But this is the kind of detail that navigators are trained to apply to different family households. So we encourage people to give us a call and set up an appointment to see a navigator who could talk about your family's circumstances and what your health insurance needs are.
Yeah, and I would encourage people to consider the fact that, you know, your eyes could glaze over considering plans and eligibility and all of the things Jill just talked about, as if somebody's asking you to like choose a 401k plan. But the fact of the matter is you need to have health insurance coverage that you can afford, that covers your family and yourself in the best way possible. And so Enroll Virginia was set up and designed to provide this service to Virginians free of charge. You just need to email or go to the website or call the toll-free number, and a very patient person will walk you through all the things you need to consider. They'll help you unpack things like your eligibility and your income and who's in your family. But I do think that people are not focused on this. There's a lot going on in November, and it's 6 weeks. And so if you miss this November to December 15th window to make this choice, then what you're left with is if you have a qualifying event in the insurance world. And that's what Jill was referring to when she was talking about the fact that if you lose your job and you lose your health insurance coverage, that's a qualifying event. So you can get covered. If you have a baby, or let's say you get divorced, I guess, and lose your insurance coverage. There are things that are qualifying events outside this window of enrollment. And so you do need to be aware of that too. So Jill, you know, I'm assuming people can access Enroll Virginia when they need questions like this answered.
Yes, absolutely. And we could provide advice only over the phone, or if people need more assistance, we are figuring out ways to do our work virtually so that we can still assist people with the paperwork that's necessary, or even as simply as making a three-way phone call to the marketplace so we can assist people with their applications. I also want to point out that immigrants who are legally residing in the United States can get marketplace coverage with tax credits. So again, it will depend on the immigrant's household size and their income to figure out what their tax credits will be. Some immigrants can get Medicaid coverage, but that coverage is fairly limited, except for access to what's called emergency only Medicaid. But when people can't get Medicaid right now because of the restrictions on Medicaid coverage for immigrants, even when they're low income, they can go to the marketplace and get their coverage there. And we believe that's that a large portion of Virginians' uninsured individuals are folks who are legally residing immigrants or even children of those immigrants, some of whom may be U.S. citizens who certainly should get the health care coverage that they're entitled to. So again, some of the rules are complicated, but we're in a position to help people sift through the details and figure out what suits them.
Yes, and you hit on something really important about children who would be eligible, and maybe are going to be eligible through FAMIS, FAMIS. For those of you who are not accustomed with that program, it's FAMIS, FAMIS. And again, Medicaid is different from Medicare, and I think a lot of people who have heard people talk about Medicare for all, politically speaking, might be confused about the difference. So when we come back from this break, I'm going to ask Jill to just briefly explain to us sort of who, in a broad sense, is eligible for Medicare, Medicaid, and FAMIS, because Virginia has worked really hard since 2019 to close the gap. When we pushed for Medicaid expansion, it was to close the gap and make sure that there were not Virginians falling through the cracks who had no health coverage to fall back on. So please join us after the break. This is Your Need to Know, and we are talking with Jill Hanken of the Virginia Poverty Law Center.
Our fight against coronavirus isn't over. Let's wear face masks in public, stay 6 feet or more from others, follow state and local guidelines, and wash our hands frequently. Let's move forward together. Learn more at coronavirus.gov.
Opiates has taken everything and everyone I've ever loved away from me. Everything.
I blew my ankle out and I got prescribed pain pills by my doctor.
If making my detox public is gonna help somebody, I'm all for it. I just wish I would have had a warning.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
America, land of the free. It's at the core of who we are. Freedom. The freedom to live without fear, to drive through all 50 states, to sleep safely in our own beds, the freedom to jog where we please, to watch birds in the park, to wear a hoodie, the freedom to breathe. Before we celebrate the freedom most Americans have, we must fight for the freedom all Americans deserve. Because no matter your religion, gender, disability, age, race, all lives can't matter until Black lives matter.
Even though there is so much against us, you will see me wearing a face covering.
And even with my face covered,
you will see me
as a son,
as a friend to everyone I meet,
as a fighter for change,
as a woman who stands up for what I believe in.
So join me in wearing a face covering
to help stop the spread of the coronavirus.
Because this is one small act of kindness that has the power to bring us all together.
Welcome back to Your Need to Know. I'm your host, Catherine Reed, and tonight we're talking about open enrollment for the ACA and for Medicaid. My guest is Jill Hanken. She is a health attorney with the Virginia Poverty Law Center here in Virginia, and she's walking us through what we need to know in this very important period between November 1st and December 15th. Thank you so much, Jill, for taking time to be here and to explain to our viewers what they need to know about these different healthcare coverages and who is eligible for them.
Thank you, Catherine. Yes, we're here especially to remind people about the open enrollment period for marketplace coverage through the Affordable Care Act. But I also want to remind folks about the existing public health insurance programs for which they might qualify. And those programs are Medicaid, Medicare, and the FAMIS program, FAMIS. And just to give you a brief overview of who qualifies for which programs, and it can get complicated, but let me give you a brief overview. Medicaid is generally for low-income families and children, pregnant women, the elderly, and disabled. And for each of those categories, there are some different rules. But for kids, pregnant women, parents, and now low-income adults, Medicaid is available to provide comprehensive health care. And the income rules vary for these different categories. I'll say just generally that for children and pregnant women get the highest income levels for either Medicaid or the FAMIS program. So for those kids and pregnant women, their family income, let's say for a family of 4, can be as high as almost $54,000 a year for a family of 4. The kids or pregnant women in that family can get coverage. Our new coverage in Medicaid for low-income adults, for that same family of 4, the limit for income for the parents or the adults in a household of 4 is $36,000 a year. So you could see the variation there. Now, there are different rules for elderly and disabled. Typically, the income is even lower than that amount. And for elderly and disabled people who have very high healthcare costs generally, there are also some rules about how much money they could have in bank accounts and other resources. But that's not an issue for the families who get coverage. Now, contrasting with Medicaid is the Medicare program, C-A-R-E, at the end, which is the national healthcare program for individuals who are over age 65, who have a record of work within the Social Security system. They get Medicare basically automatically when they turn age 65. And Medicare is also available to people who've been disabled for over 24 months and for folks who have renal failure or Lou Gehrig's disease. So Medicare is a whole different program for folks, although some Medicare beneficiaries can also get Medicaid to cover expenses together. And within Medicare, you all have probably heard about Part A and B and C and D. It can be complicated, but basically when you put all the alphabet soup together, Medicare is very comprehensive care. So we have Medicaid for lower income people. We have Medicare for some disabled and older people. And then we have the marketplace, which is basically for everybody else who doesn't have employer-based coverage. And remember that most people in Virginia do get their health insurance through their jobs. So the ACA marketplace, helps people all the way up to 400% of the federal poverty line. Again, for a family of four, that's all the way up to $104,000 a year for a family of four. If you're under that level, there will be tax credits available to you to help pay for your premiums. But even if you're above $104,000 a year and you need health insurance, you can go directly to the marketplace, healthcare.gov, and buy insurance there, although you'll be paying the full cost of insurance, and absolutely it's very expensive. But the whole system, tries to reflect differences in income levels. And now in Virginia, since we do have our Medicaid expansion in place for low-income adults, most Virginians have a place to go for their insurance, including all legally residing immigrants. For immigrants in Virginia who are not documented, if they would otherwise meet these income rules, they could actually get emergency services through Medicaid. And that's the way a lot of people get labor and delivery services, or help after a heart attack or an accident. So all of these programs do fit together. I guess you could call it a crazy quilt, but they do fit together to offer health insurance, and we want to be available to help people figure out where they fit in and to jump through the hoops necessary to apply and enroll and select the health plan that's going to work best for you.
You made a very important point, Jill, though, about the fact that there are some people, because of what you hear in the media, who don't even think we have ACA. The Affordable Care Act is still very much alive and well. There is no longer an individual mandate. I think that may have been what used to be required to have some kind of health insurance, and that doesn't exist anymore.
Right.
So yeah.
Yes,
so,
yeah, right now the Affordable Care Act is in place and people are busily enrolling in health plans. If you already have a marketplace plan, you may get a letter saying you could just auto renew. We hope you'll take the time to look at your options this year, because your options may have changed. And we want to make sure you have a plan that works for you, and a plan that your doctor, your hospital, and your medications are covered. So please don't just auto renew. Take some time to check out your options. But the Affordable Care Act is in place. There are challenges to it all the time. And in fact, there's a big case pending in the US Supreme Court right now. We won't know the outcome of that for many months. But it is comprehensive insurance that serves 20 million Americans get health care because of the Affordable Care Act. Half of those are people who have gained coverage through Medicaid expansion, which is now available in the large majority of states, including Virginia. So the ACA is what has made it possible for us to all have insurance that also has important consumer protections, like coverage for pre-existing conditions. That did not exist before the Affordable Care Act. And people don't remember that before the Affordable Care Act, most plans had limits on the amount of services you could get every year, and even lifetime limits on the amount that the insurance company would have to pay. That's gone. Our children stay on the parents' plans until age 26, and women are no longer paying more for their premiums because they're women. The cost of coverage can vary based on where you live and how old you are, but it can't vary because of your gender. So all of these protections that we now have grown very familiar with are a part of the Affordable Care Act. And so I am extremely hopeful that the Affordable Care Act will continue to provide the quality coverage that it now provides. And absolutely, pre-existing conditions is so important for everyone. And now with COVID hitting communities so hard, it's nice to know that people have a place to go. If they lose their job, lose their health insurance, they could go to the marketplace or to Medicaid and get insurance to protect them and to help cover healthcare costs.
And so I encourage everyone to take advantage of Enroll Virginia. And you can access that at enrollva.org is the website. And you can also find them through the toll-free number, which we're running along the bottom here, and through email, which is info@enroll-virginia.com. So thank you so much, Jill, because I think that people are confused by this. I think the deadlines have passed us by as we're focused on the election and many other things going on right now. And I'm just going to put in a plug for advocacy work that Virginia Poverty Law Center does. The legislative session for 2021 starts in January. Seems like we just finished the legislative session because we just did. It was the longest legislative session in the history of Virginia in special session. But the fact of the matter is that people need to work with the Virginia Poverty Law Center to help raise up issues that are still hurdles for low-income Virginians in accessing quality, affordable health care. So that's vplc.org to find out more information about what the Virginia Poverty Law Center is doing. And again, I thank you, Jill, for coming on and letting us know. And for those of you who are at home, this is what you need to know about the enrollment period from November 1st to December 15th. Don't let it pass you by. Reach out to Enroll Virginia and get some assistance in choosing the health plan that is right for you and for your family. And this is what you need to know.